Welcome to the Greater Culture Podcast, where we have conversations about how to elevate the quality of life through movement, nutrition, recovery, and mindset practices. Welcome to the Greater Culture Podcast, a special edition here on location. And I'm joined by TC from Trilogy Chiropractic. Actually just finished a session, getting an opportunity to be worked on by TC, and now we're gonna get a chance to chat with him about his experience and his role as a chiropractor. So TC, thanks so much for joining us today.
I appreciate you having me on here. Awesome.
So new practitioner to the area in chiropractic. So I'd love you to tell us a little bit about your journey and how you came to be a chiropractor here.
Awesome. So fun fact, just if you're a local in the area, I was born and raised in Fuquay, actually five minutes from this gym, which has really been cool. But local boy, grew up playing athletics. I played soccer all the way into college. During high school, I actually got injured my back playing, and went to my first chiropractic appointment ever. And very cliche, but literally after the first adjustment, I was like, this is what I have to do with my life. So it just happened to be right when I was getting more into the anatomy classes in school as well. So it just was perfect timing. And from then on, seriously, since I was 16 years old, I set a path to become a chiropractor. So worked with my local chiropractor, went to App State, got an exercise science bachelor's degree, and then immediately, actually took 3 years off, worked at a car dealership to help save some money up, but then went to chiropractic school, graduated last March, not January, March, and then started my own practice, my own mobile chiropractic practice in July of 2022, and we've just been slowly growing since.
Yeah, it's really cool to hear and see the development and how you've been able to build a practice here locally as a chiropractor. So there's a lot of different types of folks who help people, massage therapists and PTs and chiropractors. What does the schooling look like to be called a chiropractor?
Yeah, 100%. So chiropractic, which is actually pretty cool. A little backstory on my personal experience. So I didn't even realize when going into school that there were multiple different techniques, philosophies. Like I said, I just had my one adjustment time and was like, this is what I need to do, and focus more on the schooling. And, the reason I picked the school that I went to, it was just a very well-known school. The founder of chiropractics is actually where I went to, Palmer, down in Florida. And obviously I wanted to go down south as well. I know this is more about the schooling, but wanted to go down south, didn't want to go up north, and it was by the beach, so it's hard to miss. But I kind of fell in love with the sports and rehab side of it. When I got into school, obviously because that's my background, but there's multiple different ways that doctors can help. Chiropractors in specific, we help with three main things that I like to focus on. At least this is my philosophy. We help with the joint system. So how the segments of the joints in your spinal cord, in your extremities move. The musculoskeletal system, so how the muscles that are connected to those bones to those joints move, and then also the central nervous system, so how the body actually communicates with each other. So as a chiropractor, those are the three things that I'm really focused on. But I wanted to go a little bit farther than that. Just as I was going through chiropractic school, obviously I spent a lot of time with the technique side of it, which is a little bit what makes us different than other doctors. So the doctorate program is a very, very heavily intense program. It's a 5-year program that we squeeze into 3 years and 3 months. First year, you basically learn everything that you need to refer out. So we do learn multiple different diseases and issues that we need to be able to tell right away if a patient comes into us, if we need to refer out. So basically the first year, they almost kind of scare you to show you all the bad stuff that we don't need to treat. Second year, we really focus on what we can do with the chiropractic adjustment, what we can do with rehab, what we can do with soft tissue therapy. And by soft tissue, I mean your muscles, the ligaments, the tendons, how we can treat those as well. And then that last year, you're all hands on. So you spend about a year and 3 months on an apprenticeship, preceptorship, being hands-on and working on your skill. And me, I've gone to multiple chiropractors growing up, like I said, since high school. And the one thing I did notice was that a lot of times I was getting a lot of chiropractors that either were missing the adjustment, or I basically had to come back, or I would go in for a headache and they just couldn't get the joint to move. And they're like, oh, well, it's just being annoying today. Come back next week. So my goal going down to school was to become the best adjuster I could be, because as a chiropractor, that's what you're known for. You know, if you're not a good adjuster, then what makes you different than anybody else, you know? So I hyper-focused on the adjustment skill. I actually joined a club while I was down there, ended up becoming the president of it, of a technique skill. So I really worked a lot on my technique. And hopefully if anybody comes and works with me, you can see that difference in that time that I put into it. But outside of that, I really, like I said, I wanted to work more with the rehabilitative side. So we joke. So I consider myself a rehabilitative chiropractor that focuses more on functional movements, on biomechanics. The reason why I went more down that pathway is because chiropractics and chiropractic adjustment and the multiple different techniques, they're amazing. I mean, if you've ever had a bad experience with chiropractic adjustment or a bad reaction to it, there's usually a few different reasons why, but the big thing that I see is some people just give up on chiropractics pretty quickly. And I don't want you to give up. Just go and try another one, because there's so many different techniques. But the technique and kind of the mindset that I really like to focus on is more the rehabilitative side, because most of the issues I see, obviously an adjustment will help with it, but won't help as quick as most people want it to help. And usually it's not the joints. The joint is not usually the only problem that most people have. And I think that's where chiropractic sometimes gets kind of sold short, as a lot of people think that we just rack and crack, and you know that we think that one adjustment is going to cure cancer. And that's not true, and I know that's not true. And you know, my goal coming out of school was not only to make people feel better, which a chiropractic adjustment does, where you'll get that immediate relief, but I wanted to help figure out what the issue is and actually fix the issue. So it's kind of funny, because I feel like I've almost made it harder for myself, obviously, because I spent a lot of time with the technique and adjusting, and I feel very confident in that. And I could simply rack and crack people. You know, I could see people for 10 minutes and get stuff moving and give them exercises to do at home. But the problem that I was seeing there is people weren't doing their exercises at home. So I really wanted to work more with being one-on-one with people, giving people more of my time, and spending that time figuring out what the actual issue is, and then working on it from there. So my basic theory, I guess, or the way that I approach someone such as like yourself, first thing we're going to do is figure out what's causing pain. So that's the number one goal, because that's the number one thing that's on your mind, is what's causing the pain. And then from there, we of course want to fix that pain, but we know that whatever's causing the pain most likely is not the reason or that the problem started in the first place. It's just what's mad now. Usually another bigger muscle will take over for a smaller muscle not firing properly. So I got kind of obsessed with trying to figure that out, which is why I love what I do. I call chiropractors the Sherlock Holmes of the medical field, because that's basically what we do. And I know PTs do it as well, but in chiropractic school, what sets us apart is we spend a lot of time figuring out differential diagnosis, learning orthopedic examinations, focusing on the musculature, how the muscles are going to react and how the joints are going to react to it, and how the body reacts to the adjustments. And it's been kind of funny, to be honest. The first year out, obviously I knew that it would be tough, because as a chiropractor, we almost have to prove that we're real doctors. And there's a reason for that, because there are so many different varieties of chiropractics. So depending on, you know, who you went and saw or who you talked to, there's a different mindset on how chiropractics can help. But over the years, chiropractics has gotten a very heavily researched. For example, like everything that I do is heavily evidence-based. It's been researched. There are facts that have been proven. I'm using biomechanical functions, functional screenings. We're actually moving the body, and I can show you on a camera what is not working. And then from there, we're going to figure out why it's not working. You know, it's been interesting trying to like get people to understand what I do. That's probably been the hardest thing, like starting forward for what I do, because I'm cash based, which I know that's a big different mindset in the chiropractic realm as well. A lot of people only accept or are looking for insurance. Reason for that, it just makes it a little bit easier to get patients because your insurance reference you to specific chiropractors. Reason I do cash based is because it allows me to do whatever I need to do to fix your problem, which is the number one reason why I want to help people. So whether I need to spend 30 minutes with you doing strictly soft tissue work, so you know, whether that's working on a subscap issue or a lat that's, you know, not allowing you to move properly, or the psoas muscle, or, you know, whatever is not allowing you to get in the motion that you need to, I'll spend as much time as I need to. And whether that be cupping, taping, muscle release technique is what I call it, but stripping out the muscles, any type of stretching, and then the chiropractic adjustment takes, like I said, 5 minutes. You know, I've got my technique and our palpation skills that we really hyper focus on in school and learn very well. And we can knock those out real quick. But after that, your body is really, really in the best position and neurologically the most susceptible to be able to retrain those muscles in the position that they need to be, which is why I like to do rehab right after we do that adjustment. So if you do any type of work with me, we'll do some type of soft tissue, we'll go to the chiropractic treatment, and then right after that, we go straight into some type of functional rehab to reset it. The reason for that is because you are in that best optimal position to retrain what is messed up. And so the reason we do that, usually the chiropractic adjustment will help you relieve that or the pain immediately and help increase that range of motion that you don't have. But most people don't go back into strengthening it correctly. They go back home and sit on their couch right after the adjustment because they feel better now. And all you're doing is allowing those muscles to just kind of pull everything right back to where it was. And that's why you have to go back to your chiropractor twice a week, every week for the rest of your life. Mm-hmm. And so that's why I do what I do. The way that I do it is to help hopefully not only fix the problem, we're going to get you out of pain, we're going to figure out what's causing that issue, but I'm going to be one-on-one helping you through that to make sure that you are working and progressing as you need to make sure that if we have any setbacks, we know how to take care of it, and I'm right there to help you, and to make sure that you're training and not hurting yourself as well, which is just as important. So, yeah, that's why I do what I do.
Yeah, the things that I heard there, one, incredibly passionate about helping people just get out of pain, have a higher quality of life, and be able to do all the things that they love doing, whether that's performance related or lifestyle related. And then the care and the education to get to that point, to be able to do that, takes a long time as a chiropractor. And I know a lot of times people are coming to see you when they're in pain, something doesn't feel right, something's not moving the way it should. When we think of chiropractic, a lot of times you think of the back crack and things like that. How would you describe like that experience when somebody comes to a chiropractor? Sometimes it's a little fearful because all of a sudden my head's moving a certain way or my back's moving a certain way, and I hear this pop or I feel this pop. Talk to us a little bit about what is going on there for a patient, why they maybe don't have to be concerned or worried of like, did something just rip or break or go the wrong way?
Yeah, for sure. So that is a very, very common reason why people don't come to a chiropractor. Mostly because of the cavitation noises, the noises that they're hearing, they think that something is cracking. Also, there are chiropractors that take x-rays, but, my philosophy is we're going to try to do whatever we can before having to do any type of x-rays, and figure out, because most of it's just musculoskeletal. It doesn't need any x-rays. I can take an x-ray, but then I'm going to show you an x-ray and your mind is immediately going to think something bad. Just like great example is degeneration. Degeneration is natural. It happens. But it's not a label. You know, you are not degenerating. That doesn't mean that you're weathering away. And sometimes, you know, that's why I personally have to be careful on how I communicate with people too, is because the words you say can completely alter how someone reacts. But back to what you're saying, confidence-wise. So number one thing I tell patients is I, you know, obviously ask them if they've ever seen any TikTok videos or anything like that to see if they've heard that noise. From there, we go into talking about what that noise is. So a lot of people don't realize we're not actually moving any bones. We're not breaking any bones, which is what a lot of people think. And we're not being Chuck Norris. You know, I think those movies are the big reason why a lot of people are scared of that cracking or the twisting of the neck, is because of what we've seen on TV. And, you know, you see all these samurai movies or action-packed movies where they're snapping the neck. And is it possible to do that? Yes, but the amount of force that it takes to actually do that, we're nowhere even close in that ballpark. Okay. And not only that, but we're being very precise in putting you in the position to be able to move and cavitate that joint. And the cavitation, the only reason we're looking for that is it's our our sound clarification that we are moving something. You can actually create movement throughout the body without even making that noise. So we can, you know, if the popping noise is what you're scared of, I can do a full mobilization of any of your joints where we're just moving them in a range of motion. And it doesn't feel like we're doing much, but if I test you right away and then retest you after, I guarantee you're going to have more range of motion. Just working on the muscles alone will do that. But again, that kind of goes back to why I do a little bit of muscle rehab and everything, is just because it all fits together. But anyway, so the noise that you're hearing, a lot of people think it's us cracking. It's not us cracking any bones. What it is us actually creating a gas bubble within the synovial fluid, the fluid that's in between your joints. So think about the oil, the lubricant that lets your body move. They actually thought that it was a gas bubble dispersing. Research has recently showed that it's actually us creating a gas bubble. So the analogy that I give people when they come into me for the first time ever and are scared, have never treated that. If you think of a glow stick, and when you crack a glow stick, it creates an air bubble. Literally the same concept, where we actually create a gas bubble and it just makes a cracking noise, a cavitation noise, and it helps restore that range of motion. So that's the first way of like getting that noise scaring you out of it. I will also walk you through it very slowly. I will put you in every, you know, position. So I'll get you to that in range of motion where, you know, the smallest amount of force should be able to get that to move. Nobody should be whipping your head around, which is another big scare. Talking about the scary stuff with chiropractics, obviously, some people are scared because they hear that chiropractors cause strokes. So the reason we do a full-on examination, why we check your blood pressure, why we do all the orthopedic examinations, is to make sure that you are not susceptible for that potential. So if there's any history of anything like that, I am going to take an x-ray. I'm having you go see your primary physician. If the blood pressure is high, we're not touching your neck. So the reason why you have vertebral arteries that run through your neck, that is why you're most susceptible with any type of rotary movements of any type of, whether it be damage, if anybody tries to rotate your head too hard. That is by far the worst case scenario. And most people that have had strokes in the past before, I'm not saying that, you know, the chiropractor that they work with, but that they were wrong, but they most likely missed something, because most people are already in a susceptible position where artery was already clogged, or the blood pressure was a little high, or there was something already there. It was going to happen at some point, but because the chiropractor did the spinal adjustment, it increased the blood flow, broke something off, caused that. So that's, in the past history, that's what they found, but that is why we go through the extensive examination beforehand. So that is by far, sounds so scary, but chiropractic care is actually extremely, extremely safe. It really is. And if you don't believe me, go ask your chiropractor how much he pays for, his insurance, his malpractice insurance, and then go ask your physicians how much they pay. It's just funny. But it's a very safe practice. It takes a lot of force to do any major damage. The worst damage that can be done is from almost someone tensing up too much and not being able to relax, and it creates a muscle strain. That's the only thing that I've not personally experienced, thankfully, but that I've heard of happening. So, but that's why we're so careful. But yeah, so that's the cavitation noise, the biggest scare of what you hear about that. But other than that, what I am doing with an adjustment is I'm looking for specific points in the body that aren't moving properly, and then functionally we're going to get them moving again. So I focus more on the specific junctions. So whether that be your upper cervical area where your skull and the first vertebrae meet, the cervicothoracic, so when the cervical and the thoracic spine meet, the thoracolumbar, so the TL junction, basically any of those junctions where the curves of the spine meet, those are the biggest key factors where we have found cause the most discomfort, and usually where the pain is normally coming from, because your body will naturally find ways to move if those areas aren't moving. So I work in those junctions and I restore the motion in those junctions. Okay. So whether it be, you're not extending as far back in your thoracolumbar junction, which I see a lot in CrossFitters, or actually we see a little bit of too much extension back there. If they don't have enough extension, they're going to feel some shoulder pain. If they're not feeling shoulder pain, they usually feel some back pain. It's usually one or the other, because they're getting that motion, because they're going to get in that position, with an overhead press or overhead snatch. So just being able to figure out where they're taking that motion from and where it's not happening is the biggest part of my job. And then trying to fix the problem and then figure out how to get that joint moving.
So it's an incredibly safe practice, one that people will feel pretty immediate pain relief, and then help train the body to move the way it does and the way it should. What I always find really, really interesting is it tends to be a more reactive type of approach to health and wellness of like, oh, my back went out, or my shoulder's not good, or something's not the way I would like it to be. Now I'm going to go see the chiropractor. Can you speak to why it might be helpful for people to be proactive of like, you know what, I might not be feeling anything in terms of a major acute injury, or my back feels out of alignment, but it might be helpful to go see someone, because I know that they're going to help me stay moving the way I should and avoid maybe having some of those issues. So talk to us about a proactive approach.
That's a big thing that I preach. So as a chiropractor, the number one way we can help is through preventative care. But the problem is a lot of people don't want to come to you beforehand because they feel like it's a waste of money. And it usually is a financial reason. It's, you don't want to feel like you're wasting your money. But that's just kind of the way the medical field has become in a general. So, you usually don't go and see someone about a problem if there's no problem until it's so bad that you can't do anything about it. So even as a chiropractor, my number one patient is someone that's coming in saying, I feel great. I just want to, make sure everything's clear. That's awesome. Because I guarantee I'm going to find something. I mean, naturally, just the way that we live, the way that I'm sitting right now, the way that our biomechanics are, something is going to get a little restricted. A muscle is going to get pulled somewhere, whether you're sleeping weird or the activities we do or driving all day. There's something that we can find for sure. But the problem is we wait, like you said. I try to emphasize to at least come and see us, whether it's once a month or once every other week, just to make sure that everything is moving, because the number one thing that you hate is when you get injured, because it's always at the worst time. Have you ever noticed that? It's right before a competition when you're pushing yourself, or, you don't have the time to be injured. But you're right. You don't have the time to be injured. And that's what going and seeing a chiropractor, massage therapist, a PT, going and seeing those movement specialists, they're going to help you the most from having to deal with those major issues, because we're going to figure out what is underlying those issues, and we're going to fix those issues. So, my favorite, you're one of my favorite ones, because, I have a little twinge here, but I'm feeling pretty good. I just want to make sure everything is moving right. That's great. It makes my job harder, because I have to figure out what is causing that little twinge, because everything looks great, but we found something, and we increase the range of motion, and next time, hopefully this week, you feel great. And we can push ourselves to that next limit, especially with athletes that I see a lot. If you're a high performance athlete, you need to be getting constant treatment, because literally the whole point of why you are a high performance athlete and what makes you different than everybody else is that you are pushing your body to its absolute limit. So, it's the same as if you watch race cars. Like, race cars break down all the time. I love to use the analogy of cars compared to people all the time, because they're fairly similar. If you're pushing that car to its absolute max, something is going to break at some point. So, keeping an eye on it, making sure that we're keeping everything moving the way it's supposed to be moving. As you're growing as an athlete, you're constantly, your muscles are getting bigger. Your anatomical positions are going to be different as you're, growing, as you're getting faster. Those slow and fast twitch fibers are going to be activating. You're going to be getting more of them. Things are going to start stiffening up. Your body's got this really cool way of stabilizing you, but at the same time, it can be almost inhibiting you from other movements as well. So, just working with a chiropractor, massage therapist, physical therapy, anything like that while you're, performing. So that's why I love to work with CrossFitters. It's because it's not because they're constantly getting injured. It's because they're pushing their body to the absolute max. And, we're so competitive that we got to get that one more rep, or we got to get the workout in before the time's up. So we're pushing our bodies to the absolute max. And if there's a little tweak, well, we'll figure that out later. You know what I mean?
Yeah.
But you'll figure it out later, and you keep pushing it off and keep pushing it off. And then you go a week before a event, and then you're out of the event,
Yeah.
So it's very important to really do the preventative side, but I see a lot of the reactive side of it. Even to the point of, on the other side of it, not even just high performance athletes, but everyday people, they'll go throughout life and they deal with an issue, and they'll have a pain or something like that. And the first thing they do is they go to their doctor, and their doctor prescribes them medicine. Now, I am not against medicine whatsoever. There's a time and a place for it. But the problem is usually what they're doing is they're trying to just alleviate the pain and hide it. So someone gave me a funny analogy of, like I said, I'm going to go back to cars. You take your car in, it's got a knocking noise under the engine. And the mechanic looks at it. He puts some styrofoam all on the inside of it, closes the hood. You don't hear the knocking noise anymore. Did you actually fix the problem? No, you didn't. We masked it. That's basically kind of what we do with medicine. That's what ibuprofen does. It's an anti-inflammatory. Ice does the same thing. Biofreeze. The whole reason Biofreeze is a thing is because it makes you feel like the area is cold rather than painful, because the receptors in that area feel heat or that cold temperature before pain. So they're basically cutting off the pain receptors. That's the whole background of that. So what I see even is I'll have people that say, I've been to my primary care physician, I've seen an ortho, I've gone and got a massage, I've seen a PT, and it's just not going away. That I see a lot of patients, and chiropractic care is their last case scenario. And, it would be great if they would come and see us first, not just because I'm a chiropractor, but because our whole goal is to figure out the best options for you. And whether that be a segmental joint that is not moving, and that's why, because you just went through all of that stuff and you never actually moved the joint that's pushing into the rest of your spine. I had a CrossFitter recently that did that. She had seen 4 or 5 different people been to massage, had done 6 months of PT, and that she just couldn't get the stabbing pain out of her low back. And come to find out, her sacral bone, the pizza-shaped bone in between your hip bones, was pushed forward. And so we just got it to move, and loud cavitation. She stood up and she's like, it's gone. It's completely gone. And that's where you hear the miracles of chiropractic. It's nothing miracle. We just get stuff moving. And, you know, unless you push that joint into the position it needs to be, it's going to be there no matter how much you work those muscles out or get the muscles to relax, you know? So that's why I pushed a little bit more for the chiropractic side of it. Cause you know, I can relax a muscle as much as possible, and I can work out a muscle as much as possible, but I'm never going to be able to get that joint to move unless I actually manipulate it. So that's why I like to do the chiropractic side of it so much.
I've experienced firsthand that how proactive approaches can be super beneficial. I've been injured before to the level that's like, ooh, don't want to get up off the floor for a while, and then you go see somebody and help. But when you go in and meet with somebody and you're like, you know, I feel pretty good today, and you move around and you're like, all right, everything's moving for the most part pretty well, but we do find some of those little nuances, and next thing you know, you've got a few exercises and things that you can incorporate into your day-to-day. So you're not reliant on the practitioner to give you all the information and go see them every day, which is one of the things I love about finding the right practitioner, somebody who's going to set you up for success beyond just the appointment. And in your case, you love to give exercises, do the exercises with folks. Can you talk to us about why that can be really helpful, or why people might want to incorporate some of those little things into their day to maybe mitigate sitting all day or some of the things that our body does that gets us out of alignment or out of whack?
Yeah, for sure. So I'm going to start with the cliche saying of motion is lotion, because it is. You know, we as humans are made to move, and that's why, you know, we start becoming so sedentary and start feeling the pain. You know, that's when the pain kind of sets in, is when we start using that sedentary lifestyle. But my philosophy and the reason I love to do what I do and why I give those exercises, my goal is not to see you for the rest of your life. I'd love to see you for the rest of my life. Are you kidding me? That'd be awesome. But my goal is to educate you and teach you how to be able to tell when your body is not reacting properly and how to fix it yourself. Okay. So that is why I hyper focus. Anytime you work with me, I will always give you some type of exercise or stretch, depending on what you need, where you are in your treatment plan and what your body needs. I will give you something to do at home. I call it homework, but it's just something that I want you to add into your toolbox, because the whole point and the reason why most people get injured is not because they are just pushing themselves too hard or living life wrong, or like the biggest thing I hear is, oh, my posture is terrible. There's no perfect posture, to be honest. It's just you're not moving enough, you know? So the joints are getting stiffer, and naturally they're starting to stabilize, stuff starts calcifying, and that's when you find yourself just absolutely locked up, or the muscle spasming. Or that's a whole nutrition side too as well. But yeah, so you know, I love to give exercises, even if it's very small exercises, something you can do 5 to 10 minutes every single day, to whether it be opening up that joint space or relax the muscle that you need to. I think it's very, very important. As doctors, you should be getting some type of education about your body. I mean, it's your body. It's your one body. And you know, there are so many different things that can annoy you throughout the day. There's nothing that's going to annoy you more than your body not working properly. So, you know, being able to understand that, and even going into the mental aspect of it, of not seeing pain as a problem. Pain you shouldn't be scared of pain. I like to tell my patients that. Like, I don't want you to fear pain. I want you to understand pain. There's a reason for it. Your body's telling you, hey, something's not right here. We need to figure this out before it's a more serious issue. So understanding when you do get pain, or those little twinges is what I call them, to be able to have the tools to be like, all right, what's going on here? Let's figure it out. Let's look at these different positions. And then from there, if you still can't figure it out with the exercises or stretches I've given you, come and see me. Or even then, hey, doc, I've got a little twinge here. Do you think these exercises are great? Yeah, absolutely. Let's do that. Let's do maybe this one more exercise here. Stop by. Let's make sure the joint's moving okay. And then we'll go from there. And from there, I've been able to see more people stay healthy and active. And that's when you're seeing people hit those PRs. And I just recently graduated a patient out of a care plan, and she saw me an hour a week. 1 hour, which I had someone give me the analogy of, as a doctor, I'm trying to do everything I can in that 1 hour to help you as much as possible, but it's 1 hour out of your day. I'm less than 5% of your entire week. So I need to be giving you something for you to be able to do the rest of the week to make the actual difference. You see me for an hour a week or twice a week is not going to change what has been slowly been happening over the past few years, the past few months, whatever you want to say. It's not going to be fixed in an hour. So, giving you those little tidbits and exercises and movements, not only to make you feel more confident in your own body and being able to handle it, but, to give you that little extra something to do on your own. I think that makes the biggest difference out of everything. And, that patient I was just telling you, I spent an hour with her a week. We spent 6 weeks, but outside of that, she every single day was extremely consistent with her rehab. And it didn't even take 6 weeks to fix. It took 3 weeks. And the rest of that time we were getting her back into the movements. We were able to figure out other little stuff because the pain was gone. It was just now we can focus on the other stuff and getting her back into, performing at a higher level. So it's really cool.
Yeah, that's one of the things that I've come to appreciate and understanding and working with different practitioners is you have a wealth of information and education and all this expertise. And when you can start to distill that and actually be able to communicate it to a patient in a way that's like, oh, that makes sense. And I'm starting not only to understand how my own body works, I'm also understanding the things I can do to solve the problems where I don't have to keep going. And there's certainly a time and place to get that proactive care and get the adjustments and get seen. But it's also a really awesome thing when you start to see a client or a patient be like, oh yeah, like this was going on. So I adjusted and I adapted and I added these things in. Next thing you know, I was great. And I could continue my life the way I'd like to live it. I wasn't debilitated or, injured or whatever it might be. So I think that's always really important to find a practitioner who is taking all the education information they have, putting it into a method that I can understand, I can implement, and then we're working together versus I'm going in and seeing you for 10 minutes and I'm out and I'm just going to keep that process going, not really knowing or understanding where I'm going with that. And so I think that's one of the reasons why I know I've really come to appreciate working with you is the intense focus and study on like how things are moving and how the body's operating, which makes it worthwhile, I think, as a client. And so I'm curious, so for folks who are interested to reach out or maybe connect with you or work with you, how can they go about connecting or finding you?
Absolutely. So with me being as small as I am a mobile practice right now. We're slowly going to be growing. I haven't told almost anybody this, but we're going to be moving our practice down to Wilmington, North Carolina. So if you're in the Wilmington area, please reach out. Right now, if you follow me on at Trilogy_Chiropractic, that's the best way to get my information. I actually post a bunch of exercise videos, like I said, little tidbits here and there to help guys out. You can give me a call, and then our email is drtc at Trilogy Chiropractic, PLLC.com. Those are the best ways to get a hold of me. We offer free consultations, so you can give me a phone call. I don't care if you have a fever and you can't figure it out. My goal is just to get you where you need to be. But yeah, if you've got anything going on, please reach out. I'm definitely here to talk. And, I tell people all the time, if I could do this for free, I absolutely would. They just charge us an arm and a leg to go to school, unfortunately. So, we do have to do that. But yeah, no, for sure. Even if it's not me, if you're looking for a doctor out there, find someone that is not only invested in your health, but passionate for what they do. That's a big thing that I at least want to to perceive to my patients. And I hope that my patients feel that I'm just as invested in helping you as you are in helping yourself, and very passionate. You know, it makes me happy to get you back to the activities that you want to be, because I know what it feels like when you're doing that. So for now, those are the two best ways to do. Follow me on Instagram. All my links are on my bio. I have my link tree on there at Trilogy_chiropractic. My email again, drtc at trilogychiropracticpllc.com. Working on my webpage right now. So as soon as that comes up, I'll put that link in the Instagram as well. But,
yeah. Well, appreciate you taking some time to share a little bit about what chiropractors have to go through just to become a licensed practicing chiropractor, a little bit about some of the adjustments and the way that you like to work with folks, because I know I certainly subscribe to the proactive care that can help educate, help identify those areas for need, and then figure out ways that we can continue to get people moving along to have that better quality of life. So appreciate you jumping on the podcast today.
Yeah, of course.
And excited to see where things go for you.
Yeah, I'm super excited to help everybody out.